Welcome to this ASN Kidney 360 podcast. I'm Deepal Patel, an assistant professor of medicine in the Division of Nephrology at Johns Hopkins University School of Medicine. On behalf of our study team led by Dr. Mariana Murea at Atrium Health Wake Forest Baptist, I'll be discussing our study published in Kidney 360 titled Facilitators and Barriers to Patient Enrollment in the AV Access Trial of Vascular Access Outcomes, a qualitative study. This publication highlights data from our qualitative substudy of the arteriovenous or AV access trial. The AV access trial is a randomized controlled trial studying outcomes of older adults who are receiving hemodialysis with a central venous catheter, who are randomized to receive either a surgical AV fistula or AV graft. The AV access trial aims to address gaps in our understanding of outcomes associated with these two access types when placed in older adults, and may help support newer vascular access guidelines which emphasize the need to personalize dialysis access choices for each patient, rather than following a fistula-first approach for all. The trial was conducted initially in 7 sites across the U.S., each of which had a vascular surgery physician investigator, a nephrology physician investigator, vascular access surgery and nephrology physicians, and a study coordinator. However, after 12 months, we found that recruitment for the trial was slower than anticipated. We therefore initiated a qualitative substudy through which we engaged investigators, physicians, and patients to understand facilitators and barriers to recruitment for the AV access trial specifically. We held 2 focus groups, one with nephrology physician investigators and one with vascular surgery physician investigators, to identify shared and variable experiences between clinical sites. We individually interviewed nephrology and vascular surgery providers from each site, as well as patients who either enrolled or declined to enroll in the main trial. Open-ended questions were used to guide focus groups and interviews. Redacted qualitative transcripts were then reviewed by the study team and analyzed thematically. In total, we interviewed 12 physician investigators, 19 physicians, and 21 patients. Participants identified 4 key themes which shaped their perspectives on recruitment for the AV access trial. First, site investigators in particular identified barriers related to characteristics of study sites chosen for the trial. Some sites had a smaller pool of eligible participants than anticipated, which may have been related in part due to patients receiving dialysis care through dialysis units not affiliated with the participating institution. Additionally, some patients who may have been eligible were referred to vascular access surgeons who practiced at external sites. Second, site investigators and providers commented on the importance of buy-in from clinical teams, which was limited by pervasive biases from the Fistula First initiative. Multiple providers voiced a strong preference to place AV fistulas whenever possible, which likely resulted in fewer numbers of patients being referred to trial participation. Some providers also expressed uncertainty surrounding appropriate eligibility criteria, with some commenting that an age cutoff above 75 to 80 years may be more acceptable than the trial's age cutoff of 60 years. Third, participants noted barriers related to processes of referring patients to vascular surgery for AV access placement. Not only did patients sometimes face long wait times to see a vascular surgeon, but they also faced barriers related to insurance coverage for access placement, or access to transportation to attend vascular surgery appointments. Some site investigators alluded to the potential benefit of more coordinated efforts by the study team to ensure that patients who were eligible for the trial were able to see vascular surgeons within a short time. Fourth, patients and providers commented on the importance of methods to recruit patients into the trial. Patients sometimes had a predetermined type of preferred vascular access, which precluded enrollment in the randomized trial. Vascular surgery providers were felt to be the gatekeepers of trial enrollment, as patients could hear about the potential equipoise between AV fistulas and grafts directly from their proceduralist. Participants also highlighted the importance of patient-friendly recruitment materials which outlined the minimal time and effort required for trial appointments. We did not interview study coordinators or dialysis unit care team members who may have had additional insights surrounding facilitators and barriers to trial enrollment. As a cross-sectional analysis, we did not evaluate changes in facilitators and barriers over time, nor did we directly compare experiences across study sites. Our data was synthesized into actionable steps to increase enrollment in the AV Access trial, and many of these steps can also be implemented into clinical care to increase the rate of vascular access placement. For example, concerted efforts involving nephrology and dialysis care teams should be made to ensure that all patients who are receiving dialysis with a central venous catheter are aware of the potential benefits of having a surgical vascular access placed. Patient-directed initiatives can include multidisciplinary approaches to address issues such as transportation needs to get to vascular surgery appointments. Simultaneously, provider-directed education is needed to address the pervasive biases of the Fistula First initiative, and to ensure that all providers are aware of the potential equipoise between AV fistulas and grafts for older adults receiving hemodialysis. Qualitative methods have been used widely in other fields of medicine to explore recruitment challenges in randomized controlled trials. Our qualitative substudy produced actionable findings, and since the time of this substudy, recruitment for the AV Access trial has been exceeding monthly recruitment targets. We encourage other trialists to consider qualitative substudies before or during trial implementation.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.